What happens when you get a hernia? I'm Dr. Simpson. I'm a surgeon and I know a lot about hernias because I've fixed a fair number of them. A hernia is when all of a sudden you get this outpouching somewhere where it doesn't belong. Like your innie becomes an outie or your groin all of a sudden grows a new friend. You don't know what it is. Your gym buddy might say, just push it in and it'll be fine. It won't. And some people say, well, it's a problem with the muscle and all you need to do is work out. It's not a muscle problem. I want you to think about this. You know that nice piece of meat you have, and I'm not talking about that. I'm talking about a steak. What is the hardest part of the steak? It's that gristle. That gristle is something we call fascia. That's what it is. It's a strong, sinewy tissue, and that's what holds you inside, especially the contents of your abdomen. And when that tissue ruptures open, we call it a rupture, or it gets very weak, all of a sudden the inside, with all of its pressure, pooches out. The typical places we see hernias are belly button, midline of the abdomen, both groins. And there are a number of other places you can see hernias. And it can only be fixed by surgical repair. Now, typically what the idea is pretty simple. You have kind of an area of weakness in the fascia. We want to close that down with sutures. If it's too large or that fascia or gristle is too weak, we will put a patch over it or under it. This can be done with a robot, this can be done with laparoscopic surgery or old-fashioned open surgery. It works no matter what. And hernias can unfortunately recur. Typically, this is what happens. Someone will get a hernia, surgeon will do a nice job fixing it. Several weeks later, they say, hey, I'm feeling good. They pick up a couple of sacks of groceries and the stitches pop, or all of a sudden the fascia tears and they get a recurrence of hernia again. And some people are more prone to hernias than others. People who smoke are a lot more prone to hernias. Why? Because hernias, we require that fascia to repair. That's collagen tissue. And that collagen cross-links to make it extra strong. But if you smoke, or if you have a vitamin C deficiency, like people who are on the carnivore diet, they don't cross-link as strong. And so their chance of a recovery is prolonged. Their chance of having a problem with that is prolonged. And there are some rare genetic conditions like some Ehlers-Danlos syndromes, such like that, that cause them to not be able to repair as well. In which case, it has to be re-repaired. You know, hernias have a little historical issue. Queen Caroline had an umbilical hernia. It popped out, and when the smaller hernias pop out with bowel in them, the bowel can get trapped in them and can die. And that's what happened to Queen Caroline. She had an umbilical hernia, probably as a result of childbirth. It popped out there and it died, and there wasn't any surgeon there that knew how to fix it at the time. And Queen Caroline famously died. So if you have a hernia, or if you have this thing that pops out and pops back,